In the year 2020, the world experienced an unexpected and rare public health crisis. COVID-19, known as coronavirus, spread rapidly throughout all countries, and the situation was declared a pandemic in March. Countries faced social and economic disruptions. There were massive cancellations and postponements of events, closure of cities worldwide, and a major economic recession. Citizens, locked in their homes, suffered anxiety and uncertainty. Worldwide, there were almost 600 million infections and 6 million deaths registered. Virtual personal interaction and work became the new normal. The impact on people's lives was unprecedented. The crisis has greatly affected public health, food and work systems, as well as mental health. The scientific community worked incessantly on creating a vaccine against COVID-19. For immigrants, refugees and asylees in the United States, especially those with less economic resources, the impact of the pandemic has been devastating. They have faced even more barriers to work, to accessing support programs and materials in their language. They were also negatively affected by changes in immigration law. Once the COVID-19 vaccine became available in early 2021, immigrant and refugee communities were able to benefit from it, thanks to collaborative work between nonprofit organizations and federal and local government programs. We talked to some immigrants living in Alameda County about their experiences with the pandemic and vaccinations. These are their stories.
The reason as to why I came to California is that I came here for work and for better life. Actually, it was because of better life, because if you compare life here and life in Sudan, there's that big difference. But here, the employment, the employment sector is doing good. If you just have to wake up in the morning and go looking for work. Yeah, I was working in a certain coffee shop in Auckland, and when the pandemic came, it really affected everything. My family, I usually stay with my cousin here. My other family are still back in Sudan, and nowhere to get money. Life was hard, no money to buy food and everything. I remember I used to even sometimes, because I didn't have some savings. I had the savings that I had could not sustain me well. And I was even tried to ask my friends to give me some credit, but each and every person, this thing affected each and every person, so you could not and you could not, anyone could not just grant you credit. And so I used to even call my people from Sudan, where I came from, to ask for some help. But they did, because family comes first, and you have the bonds, and they had to come through. So it was so shocking, and I had friends. But the good thing is that, and they healed up. No one passed, no one died due to COVID. No, for my case, I was not affected by COVID, and I never went for any test, because I think what could have made me go for the test is maybe if I felt something. The government was mentioning that if you feel some fever, some like symptoms, the symptoms of normal common cold, like coughing and fever and stuff like that, you are supposed to go and get tested. As I mentioned, the reason as to why I was vaccinated is to keep. I just wanted to keep safe, because when you get vaccinated, you were vaccinated, the chances of getting the coronavirus were low. Actually, the one who I got the news from the news. The news was all over from my friends who went for for the vaccination, and they told me, you have to go. This is how it is. It's not something hard. You just go and get vaccinated because it will be uh, it will be of your own good. And but majorly, if I may say, I got the news from the TV. First, I felt reluctant because I could hear some people saying that, oh, I was feeling dizziness, this is what I was feeling. And it is we are different. We are different. So I was afraid. I was wondering what could be the consequences, how I could feel. And I wasn't certain that it will work. So it's like we are doing the experiment, but that's not the case because this vaccine is here to help you, is here to keep you safe from the vaccine, and they should go. Yeah, I agree with the fact that the first few days you are going to feel some, some dizziness and some, uncomfortable symptoms like and all that. Yeah, fatigue, you're feeling tired, but at the end of the story you'll be okay. Within a week you're going to be okay. You're going to be back to normal and life will continue, and you are going to be advantaged in the fact that you can't get the virus. Yeah, I know you can get the virus if you get exposed to it, but your immune will be high. Like your immunity will be strong as compared to those who have not been vaccinated. So I can advise them to just be strong enough and go and get vaccinated because it hasn't harmed anyone. My plan for the future, I just want a successful life. I guess I'll just stick around here in USA, in California, and maybe I will invite some of my friends from Sudan to come here because I'm comfortable here, and I'm looking forward to have a better life and to have a good life. That's all. That's all.
Buenas tardes, Evelia Chaires. 4 miembros de familia impactados por COVID. Mis 2 hijas estuvieron con COVID al inicio de este año, 2022. ¿Qué pasó? Estuvimos juntos en fiestas navideñas con varias personas que probablemente tenían COVID y no se dieron cuenta. Y mis hijas, a pesar de estar vacunadas, pues resultaron positivas. Afortunadamente los síntomas fueron muy leves. Ellas se aislaron por respeto a los demás para cuidarse ellas y cuidarnos a nosotros. Pero al inicio también de la pandemia fue muy duro. Cuando en el 2020 nos notificaron que teníamos que cerrar el país para empezar a protegernos sobre COVID, pues mis hijas perdieron el trabajo. Fue un poco duro porque ellas estaban en la escuela, en la universidad y tenían que pagar sus clases. Entonces financieramente impactó demasiado. Y nos impactó a todos porque nosotros, mi esposo y yo, aunque nos quedamos trabajando full time como siempre, pues teníamos que cubrir los gastos que ellas originaban y ayudarlas un poquito en sus gastos de escuela. Fue difícil a pesar de que había muchos lugares que nos daban comida, nos proveían comida o ciertos servicios. Nos dimos cuenta que la información era bastante, pero también muy confusa. Demasiada información por todos lados, muy confusa, muchas personas preguntándonos qué era lo que seguía, cómo podíamos obtener esto, cómo podíamos tener acceso a salud cuando íbamos al hospital, que no dejaban entrar a demás personas, el miedo de tener COVID y llegar al cuarto de emergencia y que probablemente no íbamos a salir de allí. Fue un trauma emocionalmente, creo que nos impactó. creo que todavía nos estamos recuperando de ese trauma emocional. Financieramente, todavía nos estamos recuperando. Fueron más de 8 meses que mis hijas quedaron sin trabajo y que nosotros, los papás, tuvimos que afrontar los gastos que ellas generaban y apoyarlas. Y físicamente, pues estamos bien todavía. Afortunadamente también tuvimos la oportunidad de vacunarnos. Tengo 4 vacunas, las 2 originales y 2 refuerzos, mi esposo de la misma manera, y mis hijas solamente tienen 2 vacunas y una de refuerzo, o sea, 3. No han querido ponerse la tercera porque, pues dice, ya tuvimos COVID, no creemos que sea necesario la otra, pero aún así lo están dudando, probablemente lo puedan hacer en un futuro, pero son 3 vacunas que ellos ya tienen, mi esposo y yo tenemos las 4. ¿Por qué lo hicimos? Lo hicimos para protegernos primero a nosotros, pero también para proteger a los demás. El mayor miedo que yo personalmente tengo es saber que puedo ser COVID positiva y que puedo contagiar a otra persona, que su sistema inmunológico no sea fuerte. Y tengo mucho pavor de saber que yo contagié a esa persona. Entonces, cuidándome yo, puedo cuidar a las demás personas. Por eso decidimos vacunarnos. Fuimos de las familias que creo que al principio, cuando recién se empezó a vacunar a las personas, en enero del 2021, mi familia tuvimos la primera vacuna porque de alguna manera trabajamos con el Departamento de Salud. Entonces, eso nos ayudó bastante. Entonces, me siento muy agradecida porque no nomás nosotros tuvimos la oportunidad, pero varias personas que eran más vulnerables. Y me recuerdo cuando llegaba al lugar de vacunación, ver a esas personas mayores de edad muy contentos porque recibían su primera vacuna. Entonces, el amor que le tienen a la vida, ¿verdad? Es decir, ya me vacuné, creo que la voy a hacer, voy a seguirle, no va a pasar nada. Y si teníamos miedo a la vacuna, no, personalmente no, porque creo que el más miedo es saber que puedes infectar a otra persona, que puedes pasarle tu virus. Entonces es mejor estar vacunados, protegidos. Y yo no creo que vaya a haber problemas en un futuro con mi salud física por haberme vacunado. Entonces, lo más recomendable sería que todas las personas nos pusiéramos las vacunas. Es recomendable. Si tienen miedo, busquen más información, pero información con personas que les contesten claramente lo que necesitan saber. Porque si vienen y me dicen a mí, me preguntan a mí, yo les voy a decir mi propia experiencia. Probablemente otra persona le va a contar su propia experiencia que no va a ser de la mejor. Entonces, solamente cuídense mucho. No tengamos miedo a vacunarnos. La vacuna ha trabajado. Mis hijas se contagiaron estando vacunadas, pero los síntomas fueron muy, muy leves. Recomendación, no tengamos miedo, salgamos a vacunarnos, hagámoslos por nosotros mismos y por las personas a las que queremos.
My name is Nia Tran. My family and I, we immigrated from Vietnam over to the US back in '93, and we've been staying in the Bay Area basically most of our lives since then. Yeah, the shelter in place and with the pandemic, it was tough. I think for myself personally, I have a wife and kid, and we were working full time, but our son, who was like 1 year at a time, he was at home, and so it was a difficult challenge trying to juggle between work and family and taking care of a 1-year-old. And that was tricky, and that was very difficult. I think we are one of the few lucky individuals that have the ability to work at home while taking care of our kids. But I know of many of my staff members who I work with, they have a really much harder time just because they have to go out to work, or maybe they're in hospitality, they actually leave the home. And so there's a lot of fear just leaving the house. And then for my parents too, it's tough for them. My dad is in a wheelchair, so it's much harder for them to get around anywhere. So even with the shelter in place, they were just stuck at home, but then there wasn't enough information for them, and they don't speak English. So there was a lot of misinformation, there was a lot of fear. So they weren't sure what to do or what not to do. And they just basically had to just depend on us to kind of guide them through safety, and it took a while just to get them used to wearing masks, for example. It was harder. We were staying in touch over the phone. My parents, they're sort of older immigrants. They don't know how to use the internet. They're not very familiar with technology. And I think that's one of the bigger challenges that they experience as a result of the pandemic, which is because of the pandemic, technology usage increased and everybody went digital in all kinds of ways. But then the downside is it actually left people like my parents, who never really understood the internet, can still use a flip phone. They have no way to register for hospitals because they used to go and line up to get a reservation, or they would literally go to places physically. But when they cannot do that anymore, they don't know how to pay their bills. They don't know how to schedule doctor appointments. And so a lot of that required them contacting us, and we had to help them schedule and log in and creating all these emails and logins, because when everyone moved to digital, it left people behind who just literally just couldn't use digital devices. Yeah, there's also, I think there's another aspect of it, which is there are just a lot of COVID misinformation, whether they're getting information from their friends, whether they're getting information just because they're hearing it here and there. But I think that didn't help, but I think it kind of helped with, it generated more fears for them because there was a lack of trustworthy information that they can rely upon for them. And then even if there are that information out there, it's not that accessible because it's either online or it's not in their language. So given those factors, it took my parents a long time, for example, just to want to get the COVID vaccine. For the longest time, they did not want to get vaccinated because they were hearing about all these conspiracy theories and all this misinformation out there through their friends and personal network, but don't really have access to genuine, true sources of advice. So it took a lot of convincing, and thankfully their doctor, their caregiver was able to really just convince them that they need to get the vaccine before they were actually willing to do it. But I couldn't do it. Like, I tried to convince my parents to get a vaccine, and they just wouldn't listen to me because I am just their son, despite how old I am, despite the fact I have a family. They trust sort of their peers, and they trust people that can that understand their language better too, before they were able to even commit to doing vaccinations. So previously, I was involved with the Oakland Chinatown Chamber of Commerce along with the Burma Food Group. Basically, we launched this initiative called the Crimes Against Asian Rewards Fund, and this was something that we talked about in the news a few months ago, along with the SF police department's group. And the goal was to raise awareness regarding just the rise of Asian hate crimes that were associated as a result of COVID. I think the pandemic led to a lot of unfortunate situations, one of which was, I think people were kind of blaming sort of the Asian American community for COVID, or just purely because of the mask mandate. There's a lot of anonymousness that goes behind it because everyone is hidden behind a mask. So given these two factors, I think it led to a lot of hate crimes that's been happening in the Asian communities. You see of elderlies being attacked. In fact, my own parents living in Alameda never expected all these years, but they were robbed at gunpoint. My dad was sitting in a wheelchair in his car. He was in his car, right? But he's in a wheelchair. My mom happened to walk in at the house, thankfully, but somebody came in up to the car and started searching the car and robbing him. And my dad, being paralyzed because of a stroke and couldn't move, he was just sitting in his car helplessly screaming. But even for my family in Alameda, they were not an exception to the rule. And I've heard of many, many small businesses and many family members that either got robbed or got attacked over the years. And it's kind of saddening to see the impact, because I think the pandemic and COVID does two things for the Asian American community. One, there's a lot of fear of misinformation, and second, there's a lot of fear of potentially being targeted as well. And that was not a very pleasant experience, and it was something that we had to really struggle through, and as a community try to overcome it together.
On a busy corner in Berkeley, California, we meet a fruit vendor named Francisco.
Sí, en Guatemala. Somos vecinos con ellos. Son de Todos Santos y yo de San Juan de Tikal. Departamento de Guatemala.
Francisco lives in Oakland and comes here early in the morning every day, where he prepares glasses of chopped fruit topped with salt, tahini or lemon.
Yo llevo 3 años. Aquí empecé el primer día de trabajo. Yo solo. Por aquí sí no, pero el otro lado está vendiendo mi hermano.
During the coronavirus pandemic, Francisco had to find a way to sell his products.
Sí. No, pues yo me pasé tranquilo, casi no, ahí con la pandemia. Pues no pensé nada, solo que salí a vender así en las tiendas, a vender, porque hay veces no me pongo aquí, voy en las tiendas, vendo así por la necesidad, tengo que pagar renta, tengo que pagar comida, tengo que pagar la renta a mi hija y la familia para mantenerla. Donde nosotros vivimos 5. Vivo con mi familia, con mi hermana, mi sobrino.
Francisco does not understand very well what COVID-19 is all about. Still, they all went to get vaccinated.
Allá por la fruta. Tranquilo. Porque ahí se pone ahí en las parqueas, el restaurante Guadalajara. Mi hermano ya pasó por COVID. Pero le dio calentura, muchos. Le dio tos, le dio muchas cosas. Pensamos que no iba a morir, pero no. Pues la verdad no, es que no puede trabajar porque la verdad no tengo estudio, no estudié, ni casi no sé escribir ni leer. Porque sí, ya tengo mis clientes, me está llegando clientes.
Francisco has a message in his language, ma'am, for his compatriots who have not yet been vaccinated.
Hace falta de vacinar, me toca ya